you will find in the treatment of gastrointestinal diseases or illnesses. So first, antacids. Antacids react with gastric acids to produce a lower gastric acidity. So treatment should elevate the gastric pH above 5. It's important to always take these medications with a glass of water or milk. They should be taken on a regular schedule, usually 1 to 3 hours after each meal and at bedtime. To prevent interactions with other medications, you need to allow 1 hour between antacid administration and the administration of other medications. Gastric protectants, examples are misoprostol and then sucralfate or Carafate. So misoprostol, it suppresses secretion of gastric acid. It's used to prevent gastric ulcers caused by NSAIDs or aspirin. It is contraindicated in pregnancy, and it may cause some diarrhea and abdominal pain. Whereas sucralfate or Carafate is the other name for it. It creates a protective barrier against gastric acid and pepsin. It is taken on an empty stomach before meals. Just think, it needs to provide that protective layer prior to eating. So it's taken before meals and often at bedtime. It may cause constipation. So histamine receptor H2 antagonist. So they suppress secretion of gastric acid. They're used for heartburn and to prevent complications of peptic ulcer disease. They also promote healing in GERD. So examples are cimetidine or Tagamet and ranitidine or Zantac. So cimetidine needs to be taken on an empty stomach. So food reduces the rate of absorption. If it's taken orally with meals, absorption of the medication will be slowed. Also, cimetidine crosses the blood-brain barrier, so it may cause confusion or agitation. As opposed to ranitidine or Zantac, it does not cross the blood-brain barrier. It has very rarely are there any side effects experienced, and it's not affected by food, so Zantac is more commonly used. Proton pump inhibitors, so PPIs, these are your Prozol, so your omeprazole, like your Nexium, or your pantoprazole, or Protonix. So these suppress the secretion of gastric acid. They're used to treat active ulcer disease or erosive esophagitis. Some side effects include headache, diarrhea, nausea, or abdominal pain. Treatment of H. pylori infection, so triple therapy is recommended. Triple therapy includes that of a PPI and then clarithromycin in combination with amoxicillin or metronidazole. There is also an option for quadruple therapy if triple therapy does not work. A prokinetic agent, an example is metoclopramide or Reglan. So it stimulates motility of the upper GI tract and then an increased rate of gastric emptying. It is used to treat esophageal reflux and a paralytic ileus, and it's given 30 minutes prior to meals and at bedtime. A prokinetic agent such as Reglan is contraindicated when there is an obstruction, a perforation, or a hemorrhage. And it also can precipitate a hypertensive crisis in patients with a pheochromocytoma. So just in case that comes up in the future. Bile acid sequestrants, examples are like cholestyramine and then cholestyramine. They're used to treat hyperlipidemia in adults, those with biliary obstruction and itching associated with biliary disease. They can cause nausea, bloating, constipation, a fecal impaction, or intestinal obstruction. Lactulose. I've talked about lactulose several times so far. It's very important in the prevention and treatment of encephalopathy. In addition to, it can be used for the treatment of chronic constipation as well. It promotes increased peristalsis and bowel evacuation, therefore expelling ammonia from the colon, preventing altered mental status and encephalopathy in patients with cirrhosis. Pancreatic enzyme replacements. An example is the pancreolipase. It's used to supplement or replace pancreatic enzymes, thus improving nutritional status and decreasing the amount of fatty stools. It is taken with all meals and snacks.